Okay. You came in because you have right shoulder pain and as well as like at the base of your neck. You have had the shoulder pain before, but not like this. It started about 2 days ago when you were trying to pull a huge tree out of the trailer bed. Not moving your arm seems to be what helps out the most. But it does cause a sharp shooting pain. You also feel weak and achy most often. At its worst, it's an 8 out of 10. In the morning, it's a 3 out of 10, and on average, the pain sits at a 6 out of 10. You've been experiencing the pain every day constantly, and it's worse with movement. The pain seems to get worse as the days goes by. You cannot lift much, especially with that right arm. Pulling on your shirt is difficult. So far, the pain has not affected your quality of sleep. I know you mentioned that you can sleep through anything, which I'm honestly really impressed by. As far as what I mentioned about the previous visit, does all that sound correct? Am I missing any details, or is there something that you would like to go ahead and add? Okay. I'm sorry to hear that you're going through this. I know work has been hard and you've been trying to help out your workers and work has been picking up lately. I understand why it's so important for you to feel better and be able to get back to work. And I know time is it's very important to you. But yesterday we performed several exams. One of them was a neurological exam, and all these tests had a purpose to go and kind of like narrow down the list of what structures, such as like muscles, ligaments, nerves, tendons, and so on, what might be involved that is causing that pain. So that neurological exam that we did, when I asked you to go ahead and close your eyes, and I asked you to feel the sharp wheel, and asked you if the same intensity was throughout, and I checked in on you. I checked your muscles and your reflexes as well. So those were done to see if the pain affects any of your nerves. Do you remember those? Okay. Yeah. So they appear normal, which tells us the nerve roots are not involved. And we couldn't perform the C5 myotome test, so that was like a muscle test, and that's okay because it gave us valuable insight as to like what might be going on. The orthopedic examination, the functional test, the range of motion that we did, there are other tools that we use to kind of to narrow down what might be going on with your arm and just create the best treatment for you. What I found with those tests is that your range of motion is restricted because of the pain, which explains why you're having such a hard time putting on your shirt and just lifting heavy objects. Also, pressing down on your skin, when I was pressing down on your skin, I was feeling for different muscles to see which one it was going to go and be involved. So one of them was the deltoid. So it was like this big guy right here, and I also like palpated like all around here. What I found was a whole bunch of trigger points. What this means is that there is pain locally, especially when we press on them. This most likely caused when you try to pull that heavy tree out of the trailer trunk, the trailer bed. I'm sorry. Um, we performed that orthopedic examination, O'Brien's test. I don't know if you remember, but so I was pressing down on the top of your shoulder, and this caused pain. This caused pain at the top of your shoulder. So this is indicative of acromyoclavicular joint problems. So acromyoclavicular is short for AC. We're gonna go use AC to make it easier on me. The test results seem to point to an AC joint sprain. The AC joint is where the shoulder blade, aka the scapula. So I'm gonna go and show you right here. I'm gonna go and show you right here, but we're talking about this structure right there. Um, so that's the highest bone of the shoulder blade, and it's called the acromion. The strong tissues called ligaments connect the acromion and the collarbone right here, forming the AC joint. And the AC sprain occurs when an injury damages that ligament in that AC joint. So that damage or trauma was when you were trying to pull that giant tree from the truck. I know that was a lot of information. Take your time to absorb it, and when you're ready, go ahead and ask me questions that you might have, and I can go and repeat it again in a different way. But I want to make sure you understand what we're talking about. My recommendation would be to start treatment right away. Come into the office two times per week for the next 4 weeks. I understand the time is very valuable, and you need to be able to help your workers. In office, I will be coaching you through several arm and shoulder exercises. This is going to be helpful for that shoulder joint mobility as it heals. So we don't want to go ahead and just not move it. We want to go and make sure there's some movement. We want to go ahead and increase that range of motion. It will also help improve muscle strength and joints. So I'm going to go and show you some exercise for that. At the end of our session, we will finish with cold therapy. So it's going to go and help manage pain and any swelling. At home, I ask that you do 10 minutes of icing on the site of pain. Do not place the ice directly on your skin. Have a towel in between. Have a towel in between you and the ice. Don't put your body weight on it. So like don't go to bed and lay on it. Make sure you put the ice on it. Put the ice on you. You don't ever want to lay on it. But you can ice for 10 minutes as needed. Outside the office, I will ask that you wear a sling to keep your shoulder protected and will force you to rest your arm. So a lot of times we forget that we have pain and we'll do something sharp and it just recreates it. So we want to go ahead and make sure that for those 4 weeks we can go ahead and keep that still. Oh, um, if there's a response to conservative care within those 4 weeks, my advice would be to go ahead and get an MRI, and we can go into more details as to what an MRI is and what it's going to go and do for you and what it's going to go and tell us and you as well. I'm going to go and print out an article that has supported evidence and education on what the AC joint sprain is. As you just go ahead and read it, educate yourself on it, and you're more than welcome to ask me any questions that you might have on our next visit. The prognosis is good with the first treatment option I mentioned. I would expect you to fully recover within those 4 weeks. During the next 4 weeks, even after or during, you might have flare-ups. They can occur. But yeah, when that happens, go ahead and ice for those 10 minutes as I instructed before. Keep in mind that during this time you're gonna go to need to make some adjustments for a short period of time so that you may continue to work for many years. So if you want to go and look at it that way, focus on what's going on right now, and then you can go and go back to your daily life. But when demand is greater than what our body has to give, that's when injury occurs. So a really good thing, if there's a worker around, go ahead and ask them if they can go and help you, or even like cut down the tree to smaller pieces that you can go ahead and carry it. But everything will be okay. I will teach you the tools to have better control and have more strength, so you can prevent this from happening in the future. But yeah, just like any other procedure, there are some risks to cold therapy exposure. You might experience some hard arrhythmias, heart attack, hypothermia. With exercise and stretching, there are risks of injury in musculoskeletal system, so just our muscles, they can be injured. But in your case, I do see that the benefits outweigh the risk. Other treatment options that you can go ahead and look for is seeking an orthopedic doctor. I would advise that if there's no treatment response, to conservative care, go ahead and seek them out, see what they tell you. They might go ahead and they're probably going to do some MRIs, and you might need a surgical procedure, but we don't have to worry about that right now. I know that was a lot. Do you have any questions or concerns about the treatment option? How does all sound like that? How does that sound to you? I would like to advise you to stay active by doing your arm stretches and exercise at home. Keep coming here. We're gonna go ahead and I'm gonna go ahead and treat you. But yeah, we want to make sure that your shoulder still stays mobile. But what I mean with the sling is I don't want you to go and do any sharp pains or try to lift something. Yeah, thank you.